Peninsula Pathology Associates are longtime members of the Riverside family and have played a critical role in the lives of countless patients. As our 2021 Providers of the Year, Peninsula Pathology Associates meets and exceeds the standard for patient-centered remarkable care at Riverside.
Peninsula Pathology Associates have been a part of Riverside probably 60 years.
Right now we have 5 pathologists that participate in the group. Each one of our pathologists is quite unique, but as a group they're very formidable and they're doing great work for our patients and our community.
I believe that they are truly unsung heroes in cancer care. They are absolutely essential to our diagnosis and treatment of cancer, so they're truly valuable in cancer care.
They play a critical role in terms of how we treat patients and developing the care plan for patients.
There's a statistic out there that talks about how the laboratory is involved in about 70 to 80% of all medical decisions made for our patients. They've been referred to as the doctor's doctor.
I think people think of pathologists primarily as looking at slides of pathology, and they do an awful lot of that. But they also are responsible in large part for the quality of the blood work that gets run by our labs and the efficiency that it's run and the speed at which it's run and the tests that we run. They help determine and oversee all of those processes. So it's a lot more being a pathologist here than simply looking at slides under the microscope.
And then we have pathologist assistants who are Rod Slider and Katie Simpson. They both are, with their skills and training, they help not only the pathologist, but they also help the physician who calls in who may need to know what a particular type of sample they need to submit or a particular type of testing that they need to do. So their expertise is used in a little bit different way. Dr. Tagliente is our hematopathologist and has brought a lot of expertise with his training at Mayo to the group and streamlining some of the processes that we do in the department.
You really can't look at any area of medicine or surgery that they don't touch with their expertise.
We started what we call a neuroscience case conference. And the goal was to bring a multidisciplinary group of folks together, of physicians and clinicians together, and talk about patient care. Dr. DeFonte mainly comes to our case conferences today. Her knowledge and ability to share pathology with the team has been a great experience for the physicians and providers and clinicians in the neurosciences service line. I did work with the oncology service line, and it was during those times that I worked mainly with Dr. Schwartz and Dr. Smith. Their support and passion for both of those programs have been good for Riverside and good for the advancements of those two service lines.
Dr. David Smith is the chief pathologist, and I would describe Dr. Smith as well-rounded. In my experience, you don't always get a physician, a pathologist that is good at anatomic pathology, clinical pathology, the legal aspects, the business aspects. Dr. Schwartz is cerebral. Dr. Schwartz never stops learning. He is investigating, he's researching. He wants to be the doc with the statistics. He is the doc with the statistics. He wants to be the professional expert whenever he needs to be and whenever he's requested to be.
Dr. Emery tells a really powerful story that I know each of her partners feels each day, that they know you have cancer before you know you have cancer.
She said, I was back in the lab as there was a young female mother having breast cancer. And I wanted to read those slides and get the information to the doctor as soon as possible. She said, I read those slides and I reread those slides because I didn't want to see what I saw. But then I wanted to get that information to the surgeon as soon as possible. For they have busy schedules, and if he could tell her that evening or the first thing in the morning, that would be easier and less stressful for the family. I think her empathy is profound. I think everybody in the room felt that.
What I heard from her is an overwhelming personal approach to the care, in that she knows, and her group has demonstrated the importance of knowing the impact of their work to people in the community and their lives. And they take it so seriously, and I will forever look at pathologists in a different way, and how fortunate we are at Riverside to have them as part of our Riverside family.